Surprise! Menopause, it can affect your skin. Many people are well aware of this. However, in today's video, we're going to be talking about a particular skin change that might happen as you go through menopause and thereafter, which I almost never hear people covering. Maybe you have this. You're wondering, why do I have this all of a sudden? Where did it come from? Why is it happening? How do I get rid of it? It is so uncomfortable. What is this mystery skin finding I am speaking about? Dry, cracked feet, painful buildup of dry skin on the bottoms of the feet, and in many cases, the palms of the hands as well. This is known as Keratoderma climactericum. Now, it doesn't happen to everybody. It's not super common, but it definitely happens, and like I said, it's very uncomfortable. Stay tuned to the end of the video because I'm going to be giving you some practical tips and tricks for simple at-home remedies to alleviate this, improve it, and I'm also going to be covering medical therapies that might be offered to you by your doctor to help it go away. With menopause, there is a decline in the hormone estrogen. This is what leads to many of the symptoms women experience as they go through menopause. Our skin feels that decline in estrogen. Estrogen plays a key role in stimulating the fibroblast cells within our dermis to produce collagen. So while it's normal to lose about 1% of your collagen each year starting in your 20s, when women go through menopause, they lose substantially more because they do not have that stimulus. In addition to that, with age and with menopause, the epidermis, the top part of the skin, atrophies. It gets thin. The outermost protective layer, the stratum corneum, is not as compact and tight as it once was. It's more likely to be kind of loosey-goosey, if you will. The bottoms of your feet and the palms of your hands, the stratum corneum, the outermost layer, is really thick in this area. The reason for Keratoderma climactericum is thought to be related to the decline in estrogen. This usually starts out as these like painful, rough, thickened areas on the bottoms of the feet, in areas of the feet where you are bearing the most weight. But over time, those thick bumps, if you will, come together to involve more of the surface of the bottoms of the feet and also can impact the palms of the hands. Women who develop this range anywhere from the age of 47 to roughly 69. It can happen anywhere within a year to 10 years of going through menopause. It also has been observed in younger women who undergo a surgical menopause, like have their ovaries removed, for example. Lending further support to the role of estrogen in this skin condition related to menopause is the fact that many women have their Keratoderma climactericum improve significantly with hormone replacement therapy, even with topical estrogens. While you may not have full-blown Keratoderma climactericum, you might have noticed that your feet are a lot more vulnerable to dryness. The skin in general is more vulnerable to dryness as we age, and in particular with menopause, because with that decline in estrogen, we also are having less production of moisture-retaining factors within our skin. Our barrier integrity is compromised, and so our skin is just a lot more vulnerable to dryness, and that can lead to the development of callus on the bottoms of the feet, dry, cracked feet. Climactericum keratoderma, however, is painful. It's more common in women who have high blood pressure and obesity. Dry, cracked feet, as a side note, is more common in people who have obesity. It's aggravated by friction. The case of the feet, aggravated by poorly fitting shoes that rub, don't provide good arch support. It also can be made worse by walking barefoot. What can you do to address this? No, this is not sponsored, but you guys know I'm a huge fan of petroleum jelly. This is Vaseline brand petroleum jelly I have right here, but you can get the store version of this. Save yourself some money. Get the big jar though. After you get out of the shower or the bath, slather thick layer of this stuff to the bottoms of the feet, the palms of the hands, and cover with socks and gloves. This can really help soften that outermost thickened stratum corneum. The reason to cover with socks or gloves is it really enhances the outcome by effectively providing an occlusive shield around that petroleum jelly barrier. Petroleum jelly itself is very occlusive. Not to mention, petroleum jelly helps lubricate the skin surface, reducing frictional forces that lead to further skin thickening. Make sure that you wear shoes that fit you properly. May not be the best time to be doing flip-flops. that can aggravate this. Try and keep your feet covered. If you keep your feet covered throughout the day, with socks at least, it reduces the impetus for transepidermal water loss out of the skin and can help reduce the dryness significantly. The other game-changing skincare product, again, not sponsored, is going to be this. If you're new here, welcome, but everyone else has already heard about this probably numerous times from my video. This is the Carousel Intensive Foot Repair. As the name implies, it's intensive. It has urea and salicylic acid. Those are keratolytics. They go in there and they break up the glue between those outermost skin cells, helping to exfoliate, smooth everything out. After a shower, apply this. It's in a petroleum jelly base, similar to Vaseline. Apply this. Those active ingredients will get in there and dissolve up that dry, rough stuff. Apply it to the feet after a shower or bath, and apply it to the palms as well. And again, cover with socks and gloves. That will really enhance the penetration of those active ingredients down through that thick wall of stratum corneum. After you apply this though, make sure to wash your hands, because if you touch your face and transfer the residue of that product to like your eyelids, it can cause a lot of eyelid irritation. Ingredients that are particularly helpful for this are going to be ammonium lactate, which is a salt of lactic acid, urea, which we already mentioned, salicylic acid. Glycolic acid can also be very helpful here. These, like I said, they get in there and they help to break up that stuff and smooth it out. I don't suggest leaning into the pedicure salons to like file this stuff down, because that actually can end up making it worse. A topical retinoid might also be offered, although penetration in these areas is limited. Instead, what might be discussed with you if you're a candidate is an oral retinoid, like something called soriatane, which is used to treat psoriasis. This medication, however, is not without risks. It has side effects, so it's not right for everyone and therefore may not be an option for you. But the other option is maybe you're someone who is interested in hormone replacement therapy. This appears to be driven by the decline in estrogen. Hormone replacement therapy can help clear it up, mitigate the symptoms, get you back to the palms and soles you had before menopause. However, not everyone is a candidate for hormone replacement therapy. Always discuss that with your healthcare provider. Aside from hormone replacement therapy, topical estrogen can actually help clear this up. Now, I've talked about topical estrogen cream for wrinkles, but I don't think I mentioned it in that video for this condition, for dry, cracked feet. We see ads out there for using estrogen cream for wrinkles to replace the declining estrogen locally in the skin, boosting up collagen production. Yeah, it can work, but it also can be pretty helpful for dry, cracked feet. It's not super well studied for this particular outcome, but the loss of estrogen is what is thought to underlie Keratoderma climactericum, and there are case reports of women who develop it and try all sorts of treatments, ammonium lactate, oral retinoids, and it's the topical estrogen that got them the relief. Now, that's not to say that everyone is going to get those results. It's a case report, so we need more research, but it definitely can be an effective option for some. Whether you have this or just new onset dry, cracked feet, keep in mind that a combination of different treatments might get you the results that you are looking for, coupled with lifestyle modifications. That includes, again, wearing shoes that fit you well, that are supportive, that don't cause undue friction and trauma to the skin, letting go of walking around barefoot, moisturizing the heck out of your feet, wearing socks. If you have obesity, weight management can also help quite a bit by reducing the load on the feet. It's not clear whether addressing your high blood pressure helps to get rid of the Keratoderma climactericum. Like I said, a lot of people who develop this also have high blood pressure, but that being said, it's important to address high blood pressure with your healthcare provider, regardless of Keratoderma climactericum or not. Now, before you click out of this video going, all right, I'm gonna head to the store, I'm gonna do these things, I'm good, I figured it out, this is what I have. Back the bus up, because there are some other things that could look like this but are not it. So it's important to see your healthcare provider to confirm that this is actually what you have, because it's not really that common in the grand scheme of things. It does happen, I've seen many cases of it, but it's not like something that happens to every person that goes through menopause. So just keep that in mind. Other things that might look like this include athlete's foot, which which you can develop, or psoriasis, certain nutritional deficiencies. It is a clinical diagnosis, meaning your doctor looks at it and talks to you and decides that's what you have. No special tests are really needed, although if they're not sure, they might take a scraping of it to look for fungus. No dermatologist is ever in the wrong for taking a scraping of something and looking for fungus, because let me tell you, dermatophytes, which is the fancy name for fungus that causes athlete's foot, jock itch, ringworm, toenail fungus, they are sneaky. They're sneaky and they cause rashes that look like all sorts of things. So never in the wrong for looking for that. But all that to say, Keratoderma, climactericum, it's something that can happen with menopause. Almost no one talks about. If you're struggling with it, you're not alone. I hope these tips were helpful to you and that you will consider seeing your healthcare provider and perhaps a board certified dermatologist for further management, because it can be very uncomfortable and there's no reason you should be living in discomfort unnecessarily. So on the end slide, I'm going to put my video all about estrogen creams. Watch that one next, because that is a topic I get a lot of questions about. Women want to know, like, should I use this? Is it good? Does it work? Watch that video next, especially since we talked about it a bit here. But if you guys like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.